Hi my beauties, welcome back to Younger. Today we're going to be talking about exfoliation. And before I move on, I ask that you like, comment, and subscribe to my page and share this video with anyone who may find it useful. The reason why I want to talk about exfoliation is because this should be part of your daily skincare regimen, whether it happens during the day, during the night, or even if it happens a couple of times a week or only once a week. And I'll explain why it's so important and why it's an underutilized component of your skincare regimen. So when you look at the epidermis, which is made up of 6 or 7 different layers under the microscope, when you look on cross section, the superficial most part of the skin is called the stratum corneum. Those are all the keratinized skin cells that are pretty much dead skin cells and kind of lay on the top of the skin that provide a barrier, in addition to the underlying cells underneath that also provide a barrier. Somewhere in the middle of the epidermis, the medial cell layer is kind of in the process of maturing and going from the baby active keratinocytes, which are the skin cells, to kind of becoming keratinized, which happens when there's a keratin protein that takes up the component of the skin cell. And then those dead skin cells just kind of layer up and accumulate on top and provide a protective barrier. So they're not really active and live cells, but they're just these dead skin cells that have keratin in them, which is actually important for the overall function of your skin. But when it's not desquamated or like shedded off, it can give this dull, lustreless appearance to the skin. So many of my patients come in and they'll ask me, Doc, how do we get my skin to look more radiant? Or how do I get that glow? Or how do I make my skin look more alive? If you look at a child's skin, they have this pink, flawless, beautiful skin. You can't see the pores, and it has this very vibrant kind of radiance to it, this glow. And as we get older, the skin cells kind of start to go to sleep, and they become lustreless and kind of dull. And if you look at the opposite end of the spectrum to a really elderly patient, like if you go to a nursing home, or if you look at your grandparents or your great-grandparents, and you see they almost have this really like dull, gray, lustreless skin. And that's because the stratum corneum, which is the dead skin cell layer, just becomes so thick and just stagnant that it just stays there and just looks just dead and gray and not alive at all. So there is a happy medium. You want to desquamate your skin, you want to shut out that dead skin cell layer. You'll still have the stratum corneum line of cells at the top, superficial most layer of the skin, but you don't want it to be too thick. And so a lot of benefits come from exfoliating. So exfoliating your skin, and there's different ways you can do it, and I'll go over that as well. But when you exfoliate your skin, you're basically getting rid of that dead skin cell layer, which sends signal transduction cascades and communication to the lower levels of the skin to replicate more and to increase cellular renewal. And I've talked about this before in my other videos, but when you look at the skin under the microscope, again, you have the stratum basal layer, which are the little stem cells, the brand new baby, just born skin cells, and they tend to mature and they change over time as they go up higher and higher in the layers of the skin. As the lower layers start reproducing, it pushes those baby cells up and they become more mature, then they keratinize, and then they get to the top and they hang out there for a while, and then they desquamate off. And that's why your skin sloughs when you use Retin-A. That's why your skin peels after like a 3-step peel or a chemical peel. That's why that skin gets debrided off during a facial, hydrofacial, things like that. And it stimulates the baby cells to replicate faster. So if you look at a child's skin or someone in their early adolescence, the transit time for the baby stem cells to be born till the time they get to be mature and shed off is usually about 4 to 5 weeks. If you look in someone who's 20 years old, 30 years old, or even older, that starts to become slower. That cell process starts to become slower, and the baby cells go from being just born to by the time they get to the top layer of the skin, it takes like 10 weeks. So from 4 weeks, it gets drawn out to like 10 weeks, because as we get older, the skin cells start to get sleepy, they start to be less functional, and they start to become more stagnant. So you need to do things to kind of rev up your skin cell cycle, cellular growth, cellular renewal, and make your skin behave and act younger and healthier and more active. And so by doing an exfoliation if you can do it every day, that's the best. If you could do it even just a couple of times a week, or at the least bit once a week, you're basically taking off that dead skin cell layer, which makes your skin kind of reproduce itself faster. It's kind of like you're exfoliating and shedding out with the old and in with the new. And so that's why it just gives the skin a more vibrant, radiant glow. And not only that, but it makes your skin products work a little bit better, because when you put a topical skincare product on your skin, whether that be a retin A or a vitamin A derivative, whether that be a brightening agent, whether that be a peptide, an antioxidant, a growth factor, and it has to get through that dead skin cell layer. It's a lot for that little molecule to get down into the dermis, into where it needs to stimulate collagen or increase signal transduction cascades to make collagen, elastin, and to just renew the skin or have the medical benefits that skincare products can have. If you kind of get rid of that dead skin cell layer, make it thinner, it makes the products work better. That's why, you guys see I always post on Zio Skin Health, Getting Skin Ready, which we call GSR. It's basically just a cleanser and a scrub, which is an exfoliating polish, or an oil control, which is kind of like a toner, or the complexion renewal pads or the oil control pads. That whole just getting skin ready, that process of just washing, cleanse, oil control, decreases that top layer of skin so that your products work better. And that's why it's called getting skin ready, because it's getting the skin ready for the subsequent products to come, so they penetrate, they're more efficacious, and they're more active, and they work better. So there's two ways you can exfoliate the skin. You can do mechanical exfoliation, or you can do chemical exfoliation, or you can do both. So an example of a mechanical exfoliation is something like the exfoliating polish by Zio Skin Health. There's other lines that have similar polishes or similar exfoliating scrubs, but the Zio Skin Health one has magnesium crystals. They're blue, they're really cool, and basically when you exfoliate your skin, you want to go like in a circular pattern. You want to go over your chin, your glabella, your forehead, and your cheeks, and you want to exfoliate all that skin. Take about 30 seconds to a minute to do this, and then you wash it off, and your skin will feel smooth, it'll feel clean, and it'll feel soft and supple, and that's what we want it to feel like after you exfoliate all that dead skin cell layer off. Not only does it take off the dead skin cell layer, but it also takes off debris, oil, dirt, makeup, sebum, all that stuff that when it sits on the skin can cause premature aging. It can clog the pores, it can cause congestion, it can cause inflammation. Anytime you have inflammation or inflammatory cytokines, or you have all these different mediators happening in the skin, for example, if you sleep with your makeup on, that causes accelerated aging. It breaks down collagen, it breaks down elastin, it causes solar elastosis. I don't mean to use technical terms, but basically it breaks down all the good components in your skin that you want to be viable and healthy and strong. And so someone just asked me in one of my feed posts on Instagram yesterday, can you explain why sleeping with your makeup is bad? And believe me, I have nights where the last thing I want to do when I get home after going out is washing my face, but I make sure that I do it, because when you sleep for 6 to 8 hours with makeup on your face and the oil, dirt, debris, sweat that has accumulated throughout the day or through the night, or when you go out at night, you basically are just letting your skin sleep, and it can't breathe, it can't it can't decrease the amount of inflammatory cytokines that are going on while you sleep. By taking off your dirt, oil, and makeup, you're allowing your pores to be open, your skin to breathe, and for the normal cellular processes to happen in your skin. When there's a layer of junk on top of your skin can't breathe, and it increases things that are going to cause premature aging. It's going to increase mediators that are going to make acne worse. It's going to let the P. acnes bacteria proliferate and cause acne. It's going to clog up your sebaceous glands, and your skin cells and the hair follicles are going to get sticky and cause clogged pores, which can cause comedones, open comedones, closed comedones, basically causing acne and breakouts. So you always want to wash off your dirt, oil, and makeup, not only with a cleanser, but if you can exfoliate, that's also great too. So the mechanical exfoliation process is basically little crystals that kind of irritate the skin and kind of break up all the dead skin cells, which without being harmful. You don't have to scrub so hard that your skin's going to be irritated. That's not the goal. The amount of scrubbing with the exfoliation polish is just basically just a light kind of mechanical motion that's going to just decrease the dead skin cell layer on top without irritating your skin. You shouldn't be red or irritated after washing it off. So the other way that you can exfoliate is by using a chemical exfoliator. So for example, glycolic acid. So if you use like a 10% glycolic acid at least once a day, that's ideal. If it's too irritating to your skin, because it's either usually like a beta hydroxy acid or a alpha hydroxy acid, salicylic acid, glycolic acid, there's different types of acids that you can use, and these are natural components. Just because you hear the word acid doesn't mean you have to be scared of it being a chemical. A lot of these acids occur in nature naturally, and they have a natural kind of desquamative process that just gets rid of that dead skin cell layer from a chemical component as well. So using even amlactin or ammonium lactate lotion, which is an over-the-counter, it's like $20. It's a pretty cheap and inexpensive way to keep your skin cells on your body kind of exfoliating and having your skin looking on, you know, your best on your arms, your legs, your chest, and the other areas too. This is also an acid that could be like an exfoliating, a chemical exfoliator that's going to make the skin look vibrant and refreshed and renewed. And so the way that works is by a chemical kind of lytic process, which lytic, L-Y-T-I-C, just means a breakdown of something in the skin. It basically just kind of just decreases all that sticky dead skin cells that are going to allow the products to penetrate better and just going to give your skin an overall better glow because of the increased renewal. So a chemical exfoliator, I typically use for myself a glycolic acid, 10%. I use that once a day. I use it in the morning part of my regimen, and I also do my exfoliation polish once a day. I either doing it morning or night. I usually just do it once a day. Twice a day is probably overkill. And it's easier to do it if you're using a mechanical exfoliator like a scrub in the shower, because sometimes when you wash your face and you're not taking a shower, it can kind of accumulate like in your hairline, and when you dry your face off with a towel, you'll feel like the scrub like in your hair, and it's annoying. So just doing it whenever you take a shower, whether that be morning or night, is usually what we recommend for our patients and what I do myself as well. So in addition to getting rid of that dead skin cell layer, making your products work better, and just kind of stimulating your body to have increased cellular renewal, you know, there's other benefits to exfoliating as well. Like I said, it kind of cleans out the pores, which are the little opening, the follicular ostia of the hair follicle and the sebaceous gland units in your skin. By opening and debriding out the inside of the pores or the hair follicles, it decreases the incidence of acne as well. Because what happens in acne is, if you look at the skin on cross section, here's the skin, and here's kind of the hair follicle that goes down, and your sebaceous gland is underneath. By having all your dead skin cells kind of accumulate in that pore, and your skin and your oil is trying to excrete out sebum, it's trying to secrete oil, and just like the natural debriding process of the skin, and your skin cells are all, your keratinocytes are all clogged up in that pore, there's nowhere for it to go. So what does it do? It expands underneath the skin, it causes inflammation, the P. acnes bacteria proliferate in that little unit, and it can just lead to, you know, closed comedones, which are kind of like the little hard bumps that you can get on your forehead, or inflammatory acne, which are like the red, annoying, cystic-like pimples that you can get on your face. And so by doing an exfoliation process, whether it's mechanical or chemical, you're going to debride out that open pore to allow all of the components of that sebaceous gland unit to kind of have an opening and an open channel to the surface of the skin. And by blocking that, it can cause acne and premature aging. So exfoliation is really important, and there's, like I said, there's different ways you can do it, but that's the reasoning behind it. Not only will it make your skin act and behave healthier and younger and more organized, but it'll make all your other products look better too. So again, if you take a look at somebody like the elderly and they have this like dull, listless skin, it's just because they have this thick dead skin cell layer on top and their skin's not very viable or active. So that's why exfoliating is really important. And you know, for those of you who can't tolerate it once a day, I always say to start at least doing it once a week, whether it's a mechanical or a chemical. See how you do. It shouldn't cause you any irritation if you're just doing it once a week, and then you'll kind of titrate your way up. Try to do it twice a week, and then try to do it 3 times a week, and then try to do it every other day, and then finally get up to the point where you're doing it every day. A lot of these processes, say it's like an exfoliator or a retin-A or even like a laser or a peel, when your skin gets red or irritated, it's not always a bad thing. Some people will say, Doc, I don't want to use retin-A because my skin gets red, dry, and peely, or I don't want to use a chemical or mechanical exfoliator because my skin gets red. Red isn't always necessarily bad. When you look at skin that's red or pink, when a dermatologist walks into the room and they see their patient with kind of like pink, you know, red skin, of course you don't want it to be red like rosacea or red because of a dermatologic condition, but when it's vibrant and when it's pink and healthy, that's a good thing. That means there's increased blood flow to the skin. That means your skin cells are getting all the nutrients and everything that they need to maintain an active and healthy function. And when skin is just dull and there's brown patches and it's, you know, uneven in the texture and pigment and color, it's a sign of unhealthy skin. And so although you don't want your skin bright red, I mean, even when you see me on Instagram when I do my stories and I show you my nighttime face wash regimen or my daytime face wash regimen, my skin gets a little bit pink when I wash it because there's a lot of blood flow and a lot of nutrients getting to the skin, and that's what you want. So don't be afraid if your skin gets red for a minute. It will equilibrate and it'll become tolerant of that, but it may take a couple weeks. And usually I tell my patients, try everything for 2-week intervals. You know, say you're going to start an exfoliating polish or like a glycolic acid. Do it once a week for 2 weeks, and then up it the next 2 weeks, and then the following 2 weeks up to 3 times a week. So that's usually, it takes about 2 weeks for your skin to get used to a new product, a new treatment, or a new regimen that you're adding into your skincare routine. So the last thing I want to talk about, exfoliation, is by getting rid of that dead skin cell layer, it also evens out the pigmentation of our skin. So whether people have dyspigmentation in dermatology just means uneven color. So if you have brown spots, or if you have sunspots, or if you have what we call lentigines or ephelids, lentigines are like sunspots and ephelids are like little freckles. Or if you have melasma, which people, you know, if you're pregnant, breastfeeding, on IVF, if you're on birth control, if you have an IUD, this melasma are these like brown patches of irregular pigmentation in your skin. So exfoliation is a really important component of evening out the skin pigmentation, and this is why. So as your skin cells are going from the baby skin cells to the more mature skin cells that become dead and mature and they exfoliate off, there are melanocytes, which are the pigment producing cells, which live among keratinocytes, which are the regular skin cells. So we learned in dermatology residency that there's a 1-to-10 ratio of melanocytes, which are the pigment producing cells, for the keratinocytes. Those are the skin cells that absorb the pigment and display that pigmentation of the skin. So if I'm a melanocyte here, I have all these little dendrites, which are arms coming out from the cell. And once we get our YouTube channel a little bit down better, I can even draw a picture for you. But picture a melanocyte producing pigment, and there's all these arms, almost like an octopus, to all these different little keratinocytes, and you have little melanosomes, which are little vesicles that carry the pigment out, and they distribute the pigment into each of the skin cells. Now, in areas of melasma, or say a brown freckle or a brown spot, when you look under the microscope, the density of the pigment in those keratinocytes or those skin cells is a lot heavier and more dense than it is in the adjacent skin that may be less brown or more pale or your normal skin tone. So what happens is when you exfoliate your skin cells off of the dead skin cell layer on top, it basically makes the pigment distribution more even. So if you think about it, say you have 10 people lined up in a row and you're filling up buckets of water, and some person is filling them up at twice the speed as everyone else. Well, the buckets of water are going to be way more full in that person's unit than the other people's. So you have to just take that down and calm that one rapidly dividing cell or the rapidly overactive melanocyte from the pigmentation process, and just by desquamating that skin cell layer on top, the skin cells don't have enough time to get uneven and to have a pigment that's different than the skin cells next to it. So by exfoliating your skin, it basically makes the pigmentation more even because your skin cells aren't sitting around for a long time getting uneven with the pigmentation. So it's hard to explain from a physiologic standpoint, and I talk to you guys like I do my dermatology residents, and I know you guys are thirsty for this information. You guys are smart. You ask very intuitive questions that I'm very proud of you for asking, so I know that you get this. If it's a hard concept to get, I apologize. I'm trying my best to make it seem as simple as possible, but basically by exfoliating, you even out the skin pigmentation and tone because skins aren't sitting around long enough to have an uneven distribution of the melanin or the pigmentation. So hope this makes sense. So for a number of reasons, exfoliating your skin at least once a day, if you're not up for that, at least once a week is best and has multiple skin benefits, and I hope that this video illustrates them well and hope you guys could understand what I was talking about. Thanks.